इंडिया में चाइल्ड बर्थ तो एक बहुत ही इंपॉर्टेंट चीज है
जी
देयर आर पीपल हु आर नॉट एबल टू कंसीव व्हाट शुड पीपल डू टू हैव अ हेल्दी प्रेगनेंसी एंड अ हेल्दी चाइल्ड बर्थ और आपने तीन चीजें बोली व्हिच पीपल शुड बी केयरफुल अबाउट
you know it does lead to a lot of depression. I feel men are very becoming helpful, and they're changing their attitude, which is
Right.
fantastic.
Right.
But still,
You mentioned about smoking, drinking. How much of an impact do they have on the baby when you are pregnant?
most important thing is to understand, are you a high risk pregnancy or a low risk pregnancy?
That's another big challenge in India because having a child for not just the parents, I think even more is the grandparents. How much has India developed in IVF and fertility treatments? How safe are they? The percentage of women in India getting reproductive issues is scaling up.
Yes. Social
Yeah.
taboos that we have in India, surprise the reactions people give when they have the second daughter.
Oh.
It is so crazy. As a doctor, you don't know whether to congratulate them or to say, sorry, this happened.
Despite all the medical advancement, are there still things we don't know? Why does it happen that till delivery we don't know कि क्या गलत हो सकता है? Normal delivery versus a cesarean delivery. Your last words of advice for people who are either planning a child, planning to conceive, or during pregnancy. I also read somewhere that the percentage of women in India getting reproductive issues is scaling up.
Yes.
It's going up like crazy.
Yes.
Is there a reason for that?
Yes. The reason is, we are all getting married late now.
Oh.
Second, we are generally a very unhealthy population. Insulin resistance, sugars. I mean, I hardly now see any pregnant patients who has nothing written ahead, in diagnosis. Patient will have either a diabetes or a blood pressure or a thyroid issue or PCOS or something like that. Hardly anybody who is totally like kind of no high risk factor. So yes, it is our lifestyle. It is the way we have been brought up as children. Again, the issue of girl safety. बच्चों ने कभी खेला नहीं, माओ ने कभी उनको बाहर नहीं भेजा. You always need to tag along with an आया. How much बाकी बच्चे नीचे नहीं आया खेलने के लिए, तो आप किसके साथ खेलो? So children are as girls, they don't play, they don't utilize their pelvic muscles. So lot of they have a protruding belly by the time they are 23, 24. All of us, Indian diet is very carb predominant diet.
Right.
And we don't exercise.
Oh, that's very interesting. So you're saying India by nature,
Yes.
Our population and our culture is driving some of these problems because late marriage, girl is not going out to play, so there is no physical activity, muscles are not getting developed. Your diet is an issue, your safety is an issue, marriages are getting delayed now.
Yes.
So all this is causing problems
yes, to conceive. Also, a lot of couples, very unique problem India has is a non-consummation of marriage. You don't see couples like that abroad at all. That, 10 years you've been married and you've never consummated your marriage. You've never had a penetrative sex. A lot of it is like how girls are brought up, that good girls don't do this, good girls don't do that. Nobody talks about these issues, so the woman is totally close to it. So she finds it very abnormal, There is a huge percentage of people who have never consummated their marriage. And you will be shocked, when they come to us, even like married. Now we want a child, married for 10 years. So when you start taking the history, then the husband will shyly say, well, we've never had relations. So, they feel they will be judged. Ki, Arey Baba, itna time ho gaya, ab aa rahe ho. Aisa kaise, are you a man or what? They feel kind of that this is... But it is not seen anywhere else. So this is again another problem. A lot of infertility couples
and
actually...
But why? I mean, for 10 years, why?
So, they don't know, about the sexual process sometimes. Sometimes a woman is totally close, so they say, okay, aaj nahi karenge, baad mein try karenge, all that, So time keeps lingering on to a point that the man will also lose interest and will say, acha, when they have to conceive, then of course they have to do it. So they are as a couple okay doing other things, but they don't want to do a vaginal penetrative sex. So it's okay. But then when they want to have child, they have to do that.
Right. My God.
Yeah.
And you're saying that's not a very minuscule, small percentage?
No, it's not. so many times even doctors will not take this history, because if you don't make a couple very comfortable, they are not going to share it with you.
Right.
So
right.
I have seen couples come to me with this investigation, that investigation, and if I talk with them, and they will say, well, I don't know whether we've done it or not also. So
Wow.
yeah.
And so if you had to guess, what's the percentage of such people?
See, I don't
Or
run
how
an
many such people would you have seen? Number?
Plenty. Thousands.
What? Wow.
Oh, like I've been in practice for 30 years now, but yeah.
Wow.
Yeah.
Wow.
So
Wow, this is shocking.
it is shocking. It is shocking. And because nowhere else, because most of the other societies are fairly okay with this, abroad, like you go to America, UK and all, people are okay having sex anytime,
Yeah,
the
yeah.
taboos, that social
Yeah.
taboos that we have in India, that we are the most populous nation.
Yeah.
We don't know about contraception. We don't know about the sexual act. We don't know how to, protect ourselves.
Right.
So, it's very, the social dogma.
Yeah. Wow. Again, comes back to our cultural challenges that we've created, that we feel very proud of actually.
Yeah.
And but we don't realize that our own kids are going to suffer with this.
Yes.
Wow. Okay. And then there are people who do get pregnant but lose the baby.
Yes.
Right? There is, of course, the loss that happens.
Yes.
Are there any clear, strong reasons why this happens?
Well, every couple, I mean, there's a set percentage that we say. If I say 100 couples, see 100 couples in my clinic, out of that, 10 to 15 would definitely end up losing one baby.
Oh.
That's a simple abortion, a simple miscarriage. It is, I'll give you an example. So WHO, the World Health Organization, says if a man has 4% normal sperms, the man is normal. You flip it, that means 96% abnormal sperms, man is normal. So if, say, 100 sperms were being released at one particular act of being together, if there are 96 abnormal sperms, one of them have just formed faster and met with the egg, but the resultant baby is not going to be normal. Now, nature has its own ways to kind of shut off those abnormal sperms. But maybe in that particular cycle, the nature's mechanisms failed, or the egg was abnormal in that cycle. So the resultant baby would not thrive, which is okay. That's nature's failure. So the failure rate is 10 to 15%. The problem happens if you lose repeated pregnancies. So we call them, if a couple has lost 2 or more pregnancies consecutively, we call it recurrent pregnancy loss. Now, those are the challenges that we face.
Okay.
Yeah.
Okay.
With one loss, usually people will not have problems conceiving again. They will not end up into miscarriages. They'll likely not have any challenges in the next conception.
So one is not a monster.
Problem. Yeah.
One is more common, and the next one could be fine, and you don't need to get
and
too
you
worried.
don't even need any special kind of test with one miscarriage.
Okay.
Yeah.
But when it becomes 2, 3, 4,
then it's a problem.
now there is
Yes.
a repeated problem that is happening, so you need treatment.
Yes.
Okay. Okay. And is that, again, treatment which is easy, reasonable?
I would say treatment is reasonable, provided we get to the reason of it.
Okay.
Yeah. So when a couple loses 2 or more pregnancies, we label them into the recurrent pregnancy losses. So it can happen. The loss can happen anytime, say in the first 20 weeks, it's again a loss. So early pregnancy losses usually have a genetic issues, or they have antiphospholipid syndromes. I mean, I'm just getting technical here, but we don't need to. And in whatever we may do, in like 40 to 50% couples, we don't come to know of the reason why this happened. But still, even after, say, 4, 5 losses, there is a fair amount of chance that, next time the baby would be normal.
Okay.
So, yeah, the investigations can run into huge amount of money and effort. But despite everything, we may still not come to know of the reason why this happened.
Okay.
Yeah.
Okay. And the other big debatable thing in the society normally is that we want a boy child.
Yeah.
Right? And now I know people go to Babas and Pandits and, whatever, temples, and even the Pandits say, "Yahan par ye kar do to aapke ladka hoga," and all that. I mean, hopefully that is changing with the new generation. But having a male child in India is considered like,
Yeah, the nirvana.
Nirvana. कि मेरा वो उत्तराधिकारी, my legal heir has come and now my
Absolutely.
name will continue because लड़की तो चली जाएगी, नाम बदल लेगी, whatever. And this might sound like a stupid question, but I think I've met enough educated, capable, smart vice presidents of companies who believe it is possible to do things with which you'll have a male child. So is that possible?
To a certain extent, there are some things.
Okay.
But I wouldn't divulge into that because, this topic is really covered by it is a very censored topic
Of course,
the reason is we have this special act in place, which is PCPNDT,
Okay.
wherein, you have to do nothing to do with sex selection at any point in your
Right.
journey. So even if to advise a couple to how to go about a male child, you're not allowed.
Okay.
So, yeah. So, they go do their Google searches and whatever it says, let's do this, do that. People keep doing a lot of stuff.
Yeah,
But I tell everybody, देखो 50% तो वैसे ही लड़का होएगा ना.
Right.
बाकी इससे ज़्यादा चाहिए तो maybe पंडित से ही पूछ लो तुम्हारा पुत्र योग है कि नहीं.
Right.
So go accordingly.
Right. And then comes a point which you might not even be aware of because you are a doctor who's helping people have babies. But India historically has had a significant number or percentage of female infanticide, right? Where the female child is given up, or I have no idea what happens to it. Do you have any knowledge or insight of that?
Yes, of course.
Okay.
A lot of couples, especially, I wouldn't say rural, I think it's moneyed people as well, educated people as well. When they don't want a girl child, they probably would go to any extent. See, the PNDT Act is very strong. So now we cannot divulge the sex of the child on ultrasound. But, people go abroad, they go to, say, Middle East countries and all where there is testing available. So they come back and, if no doctor is available, they just pop in a abortion pill from somewhere XYZ source. To an extent that, yes, we are at the moment, the latest statistics are very, very dismal. We have only 923 girls, 2,000 boys. So boys are so much surplus and people are not getting good girls to marry with.
And this
is another reason, the violence is going up because they are not having enough girlfriends and not having people to date or people to marry.
Yeah.
All of that.
Wow.
So the discrepancy is growing up with the passing number. So all these acts and all are not having any effect.
And you're saying this discrepancy might not be just natural.
No, it is not. Otherwise, ideally you're supposed to have more number of girls as compared to boys. Because of natural selection, girls are supposed to be sturdier. Even as infants and as babies.
Oh.
Yeah, by nature. But then if you see most of the countries, they would have unequal or women are slightly in surplus. Okay. But in our country, there is so much lag and still people are running after boys.
Okay. So you said there is some abortion pill that people can have. Are these just available off the shelf?
There are people, actually government says you have to have a prescription from the doctor. But the number of people I see who have just taken them off and I don't think anybody cares. So pharmacy is not under anybody's control.
But aren't people scared? Like a mother who's going to take this pill might not know if it is safe for me to have this pill right now.
Yeah, they keep Googling and then they say, okay, if there is any problem, I'll go to the hospital.
Like if your pregnancy is already lasted for a certain period and you're having this pill, I'm assuming it could lead to some problems
to the
child and the mother.
So she doesn't want the child anyway. So she's not worried about the child per se.
Right.
For her own health, yes, if something will happen, they will take because she's so indoctrined, because she feels her survival in the house is also dependent on whether she produces a boy or not. Wow. Or especially if she's had one girl child, a lot of couples would come to doctors. I'm sure everybody else has the same experience as I have. So they say, Doctor साहब आपको तो पता ही है पहली लड़की है आपसे हुई थी अब बताओ अब हमको दूसरा करना है कैसे करें क्या कर सकते हो आप कुछ help करोगे कि नहीं so indirectly they're asking you if there is a girl child that you see will you tell us or not so so every time you have to kind of scold them or twist them away that भैया ऐसा नहीं होता
है India में. This is not just happening in the poor lower middle class income families.
No,
this is also the rich and the qualified and the capable.
Yes. I see that class only.
Oh,
because
Yeah.
so, and you will be surprised the reactions people give when they have the second daughter.
oh.
It is so crazy, you know. As a doctor, you don't know whether to congratulate them or to say sorry this happened, and it's really, and also amongst doctors and medical fraternity, it's a very interesting concept that we have. You know, we
Uh-huh.
always red flag the file. Second daughter, they are going to find fault in everything. So sisters are told take care of them, and you know, bill के लिए लड़ाई करके जाएंगे.
अच्छा.
हाँ, second daughter, तो वो they are
If
गुस्सा
they had a
उसको.
boy, they won't.
No. So it is a thing, you know, हम आपस में, you know, it's a done thing कि अच्छा वो हर बात में सिस्टर की गलती निकाल रहा है. सिस्टर didn't come in time, दवाई नहीं ठीक मिली, ड्रिप खत्म हो गई थी, आई नहीं 5 मिनट तक, डायपर नहीं चेंज करा. So we say okay fine, कोई बात नहीं.